Alrighty. Hello, everybody. My name is Neha. I'm one of the NMatch team leaders. I'll start by introducing my fellow team leaders. They'll be waving at you as I say their name. We're going to keep it short. So the first person on my list is Haley DeVille. Next, we have Gabrielle Riley. Then Maya Ramey. Nancy Lay, Andrea Mendez Colmenares, and Laura Joanna Anaro. So that was my wonderful team, and we're all really happy to, be able to work together to put this panel on for you guys, and excited to be on this journey with you all. I'll briefly explain the structure of the panel to everybody. So we're going to be doing a Q&A session. We had a Google form link that was sent out on our Twitter and Instagram where you had the chance to submit questions. We collected those questions and we'll be making it a priority to go through those questions first tonight. And the PDs will have the chance to respond. You're welcome to ask additional questions in the chat box, but we ask that you don't unmute yourself and try to keep your cameras off, just so we can focus on the PDs and listening to what they have to say. And we'll make sure as the team to record any questions that you ask in the chat, so that if you're not able to get it answered either through the chat or directly by the PDs during the panel, we'll take note of it and make sure to add it to the list of questions for next week's panel. So that's basically the structure. And now I'll hand it over to my fellow team leader, Nancy Lay, who's going to be introducing all the PDs.
Thanks, Neha. As Neha mentioned, we are joined by 5 wonderful PDs who volunteered to chat with us for an hour about all things ERAS and application related. I'll go ahead and introduce them, starting off with our adult neurology PDs. We have Dr. Buletko from Cleveland Clinic, Dr. Keener from UCLA, and Dr. Margolesky from University of Miami. And then from the child neurology side, we are joined by PD Dr. Nelson from NYU and Dr. Qaiser from University of Kentucky. Without further ado, we can go ahead and begin our Q&A. I'm going to hand it off to Maya to start off for our first question.
Hello, everyone. Thank you for being here. So our first question tonight is, would an application without USMLE step scores, but with COMLEX scores be considered?
I guess I could say yes. No, so in at least for sure in our program, and I think in most, we have our own ways of kind of comparing the two. I think it would just be kind of utilized as the USMLE would in whichever way we choose to utilize that kind of score, but no requirement to do both.
Thank you. I see a lot of thumbs up, I think, from other PDs that are agreeing.
Sure.
Is there any specific scoring translation that you use? I know that was also a question that some people were asking.
Different ways of doing that. We use in our program generally. So NRMP actually provide a calculator, and most of the program, we know they use the same calculator, and as long as it matches with whatever that is, I think that's fine.
Thank you. All right, our next question goes to Haley.
Hi, y'all. So our next question is, how large of a role do USMLE scores play when deciding whom to interview? And then also, to what extent do programs have filters, but also still practice a holistic review of applications?
I'll go ahead and take that one. I think you'll find that this might be a bit variable by programs. At our program, we use a holistic review process for all applications and don't have any specific cutoff scores for USMLE or COMLEX exams. I think most programs probably do some combination of those things on a spectrum, but I think taking the whole application into account is certainly, I think, the preferred method for most programs.
Yeah, step one has moved to pass fail, right? So you really can't use that as a filter. And for succeed, everyone has taken it. And again, there's pros and cons and discussion for that, but you can't use it as a standard filter when a significant portion of the people haven't taken it. And I think everyone wants to take a holistic approach anyway. So I don't think people would, even if they could, but they can't.
All right, thank you guys. So our next question is for Andrea.
Thank you. So our next question is more directed towards ERAS and putting the application together. There's a lot of debate on whether using bullet points versus paragraphs to describe our experiences. Do you have any suggestions or opinions regarding these?
I can kick this one off. This one might also be variable depending on preferences of how people like to read and go through these. What I can tell you is I think we have a program kind of selection committee, and we've talked about this before. And I think we like bullet points just from our standpoint, because these applications, as you all know, are huge and very lengthy. And so for us to really get a good sense of what you're trying to highlight to us, the easier that we can read that, the better, whenever we're especially going through these holistically. What I will say is that if there's something that you want to really highlight, don't feel like if you're using a bullet kind of format that you can't expand upon some things. For instance, if you're going to take one of your meaningful sections and make it hobbies, and you just want to list your hobbies, you can write a couple sentences about each one of your bullets. But reading paragraph after paragraph is sometimes really hard, especially when you're doing it holistically. So I'm not sure what the other PDs think, but that's usually our general preference.
Totally agree.
Great, we can move on with the next question. Gabrielle?
Yep, okay. So our next question is, how important is research for neurology programs?
I think this is very program dependent. I think the expectation might be different at different programs, and particularly if you're applying to like a research track or something like that, you have to know exactly what you're getting into. But I think similar to any other single item on an application, it's just kind of another item on the application. And then I don't think most medical students have significant research experience. And then if you don't, that's definitely not going to hinder you from most clinical programs. But having some is probably a bonus, but definitely not required.
I can just expand on one piece of that. When you're listing your research experience, just be mindful of what you're listing as research. I know that it's extremely variable as to what's listed. Sometimes we see, first author publications listed. Sometimes we see that you maybe had a very local poster. I think that these are all appropriate. Just when you are presenting yourself from a research standpoint, I think knowing what you're putting on there is extremely valuable, especially whenever we're looking through it. And be ready to talk about it if we bring it up.
I think we can move on to the next one. Okay. Lower up. Yep.
Yeah, so the next question is, which aspects do you prioritize more in an application? Clinical experience, research, volunteer, leadership experiences, or personality traits such as hobbies?
I think if you ask 5 different program directors, you will get 5 different answers. Everyone is very different about these things. My main interests personally have to do with clinical care and leadership, because I figure leadership is one of the harder things to teach, though it can be taught. Clinical care is very straightforward to teach, but someone's empathy or innate sort of approach to dealing with a patient may be harder. And a lot of places have very standardized ways of teaching research methodology. So I think if you come in, you can have a broad spectrum of experience before you come in and still be taught that. But I'd be interested to hear what other people have to say.
Yeah, go ahead. Go ahead, Dr. Qaiser.
Sorry, thank you. So again, along the line of Dr. Nelson idea, but I think it's a program dependent thing as well. Every program has different culture, but I think as a program director or the academic leadership, I think everyone try to see the general direction of the application. So anything that make your case strong that why you are choosing a specific line would add to that, whether it's a research experience, whether it's the clinical rotations and all that. And we understand also that specifically, I'll specifically talk about child neurology, that not many programs, even those programs who offer neurology clerkship, they don't even have child neurology experience. So we understand that our candidates may not have even child neurology recommendation letters, and may not have a specific experience focusing child neurology, but that's what they would like to do. So by the end of the time, it's the overall story that why you want to do a certain thing, and then you have other supporting evidence to that. Okay, I have a little bit of this volunteer experience. I volunteer for autism awareness. Okay, well, I did a QIP project on hydration importance in headaches in children. Okay, well, I did my adult neurology in stroke, and I really like the neural connections, and then that part of my research. So overall, your story tied to that, and then although it's not part of a question, but I think it's related to that is now in the recent SCOTUS ruling, the story is even more important, because I think all the program directors now will go through even more thoroughly the personal statement, and they will try to find the story that who you are, how you identify yourself, and your background, how that thing influenced your decision to join neurology or child neurology. So by the end of the time, that is going to be a very important thing moving forward. Thank you.
I think if there's no further responses to that, I think I can popcorn the next question to Neha.
Alrighty, the next question is, do PDs look into submitted articles? And we believe what the person was trying to ask is if they were working on a manuscript that got submitted for review but has not yet been published. Is that something that you guys dig into to try to verify that if it's been submitted, or if there's even a way to do that? I'm assuming that's what they were trying to ask.
I think there's a hierarchy to these things, right? Especially when you have people who have experiences that they can talk about, and you have publications, but you have abstracts and you have different levels of meetings. So from my perspective, I'm always going to prioritize something that's already published in a peer-reviewed journal, particularly higher impact. There was a question about authorship. Obviously, earlier authorship is better, assuming none of you are in a position to be a last author. But you be prepared to talk about what your actual contribution was, because it looks bad to list something and then not be able to talk about it and show that you don't have the understanding of it, or that you really didn't do much of anything. So publications matter more than something that's in submission. With regards to that, I think it is worthwhile putting, we can also talk about it in your personal statement, or just talk about it during the interview day, from my perspective.
Thank you. Did any of the other PDs want to speak to that?
I guess just to clarify, I definitely include it in the application, include everything in the application, and let us decide how to interpret it. But put yourself out there for sure.
Well, thank you guys for answering that question. The next one will be Nancy.
For the next question, if an applicant has lower scores or lower stats on their application, what are some other elements that they can have or that you guys look for that can attract them to the program?
I think it's a good question, and I think some people have touched on some of this, and the movement toward the holistic review of the application has really kind of changed how we review everybody's kind of applications. So someone who might have lower scores, trying to make sure that you have some leadership qualities or show your involvement in the community or involvement elsewhere, leadership qualities, as Dr. Nelson had mentioned. So I think if you can highlight everything else that you're doing to get to this point, even with maybe some lower scores, and again, some scores don't even show up, and some programs blind to scores now too. So just because you think that that may be a weakness in your application, don't, and consider your application full and holistic, because that's how we're reviewing these now. So I would say that you just try to highlight as much else as you can about your application, because there's probably a lot there that you.
Thank you. Next question goes to Haley.
Okay, our next question is, how much value do you place on geographical preference, especially considering IMGs new to the country often may not have a preference?
I'll just say, I think if you have no preference, there's a way that you can state that in your application, and there is an area where you can put some sentences explaining that. So I think it's perfectly valid and helpful for us to know, if you don't have a geographic preference, why that is. If you're just willing to go anywhere in the country to find the program that matches sort of your goals best, then tell us that. And I think that can be really helpful. That being said, I think, the program signals and geographic preferences can sometimes be used as an additional piece of information in the initial application screening process, but we certainly extended invites for interviews to people who did not have our geography in their preference, and did not send us a program signal. So again, we're looking at every single application, and that is just one other sort of additional piece of data in the holistic review process. And I think if you don't have a geographic preference, just tell us why. I think that's perfectly fair.
I want to jump in a second, because I think this is an important distinction, and I agree with everything Dr. Keener said. There's a big difference between saying that you have no preference about where you go and are happy to go anywhere, versus not signaling a preference. Because if you specifically say that you have no preference, that will show up to everyone and they'll see that, which is what you want. If you don't do anything, then nothing will appear, and it will look the same to programs as what it looks like when someone has expressed specific interest in a different geographic region. So a lot of people, if you don't specify, may assume wrongly that you actually want to go somewhere else more than that geographic region, and you can argue at great length about whether that should affect their decisions, but I think it'd be foolish not to take that into account as an applicant.
I would just say too, sorry, I know that we're only allowed to talk, a couple of us, but I think that we could probably do a whole webinar just on this topic. The other two comments that I'll make is, if you are going to select a geographical preference, there's a little section where you can free text, like what Dr. Kino was referring to, where you explain why. It can work for and against you. Let me just caution you that if you are signaling a geographic area, you may get the attention of a program that might be a state or two away from where you really want to go. I've had people that say, for instance, in Cleveland, we're the same as Chicago. And I've had people say, I'm from Chicago, I want to be in Chicago, Chicago's where I want to be. And all of a sudden, I look at that as a Cleveland program and say, well, this person really clearly doesn't want to be in this area, even though they signaled our preference. So be careful if you're open to being in the state surrounding it. It's one thing to really say, I want to be here in Chicago, but you might limit yourself in some other ways. The only other thing that I'll mention is, I think that a lot of programs are using geographical signaling as a filter, a new holistic filter, perhaps, because you get to signal 3 different areas. So if you think about it, if you're a great candidate and you signal 3 different geographical areas, we all know as PDs that you're signaling several states that you're probably going to interview at really great programs. And so our thought of, do they really want to be in this area, if you are using that geographical signal, may be a deterrent for you if you really are open to going anywhere. So if you really are open, just please say no preference.
Great, thank you guys. It's really, really helpful insight. Our next question is for Andrea.
Great. So our next question is similar. It's about the program signals. And I know this is the second year we're learning from these. So maybe this question can be answered by several of you. So the question is, how can you speak of the importance of program signals? And how likely are programs to extend an interview without a signal.
I'm very curious to hear what other people have to say about this one, but I find the signals helpful as part of kind of not necessarily the initial screen, but when you're looking at two similar candidates, this is just personally what I think. Maybe it's one way to help differentiate two similar people if one is showing that extra interest. I personally weigh it a lot less than a lot of other variables in the application, but it has some weight for me. And then it definitely doesn't play much role after interviews, at least at our program. More so maybe to get the interview than to who we decide afterwards, but that's personal thoughts.
It's tricky. I'm with you. I mean, I don't think we really have this down yet or understand exactly how. If maybe if you are from the West Coast and you're applying to an East Coast program or geographically again, and you want to say like, hey, I'm signaling you because there's a reason why I'm applying to your program that may not be obvious in my application, that could be really helpful for you. That might just draw a little bit more attention to say like, oh, why is this person in Oregon applying to my program in Cleveland? Is there a connection there? So I find that it's helpful in that sense, but otherwise it's not like, you know, you only get 3. We understand that. So it's not like if you don't signal us that there's no way that you have a chance at matching. So again, it's a holistic review, but if you're trying to draw some interest or kind of wave a flag that says, hey, there's a reason why I'm interested in you, I think it's really just there to help you all. I don't know if necessarily it definitely doesn't hurt you by not signaling a program that you're interested in.
Thank you so much. We can move on with Gabrielle.
Okay, for our next question, what filters are there for an IMG to match at your institution?
I guess none. No, I mean, at least for the initial run through of the applications, I mean, we read every single application as a committee, not every individual in the committee, but they all get seen if they're there. So non-specific.
Is there anyone that wants to add anything else different? Otherwise, we can move on to the next one.
I would like to, and then actually there's a question in the chat about this as well. How important is year of graduation? So so again, every institution have different policies. We don't have a filter per se, but if you're away from your medical school for more than 5 years, you need to have a very good reason, like some kind of a continuation, especially in child neurology. So I would say, although it's not a filter, but when you're out of medical school without some kind of a continuation in neurology or child neurology, then it may be a difficult thing. So 5 year, in a way, the way I see is kind of some kind of a filter.
You want there to be a compelling narrative, right? Because I guarantee you that's gonna, if you do make it then to the interview, that's gonna be one of the first things people want to know and want to figure out is what's been happening during that time frame. And so you want to think about that both for the interview day, but also leading up to it, of how can you again have that be truthful but also as compelling as possible.
Thank you. We can move on to Laura's question now.
Yes, so due to the pandemic, many training sites were closed to students, in particular international medical students. So resorting to maybe acquiring telemedicine rotations. So will you accept telerotation letters of recommendation? Are they considered?
I'll just be, I haven't seen any of these yet to date. I don't know if anybody else has. Yes, if you worked with somebody and they felt like they really got to know you, obviously there will be limitations, but we all are human beings too and understand that there are some limitations to what everybody was able to accomplish and do during the pandemic. So we're very in tune to that, and I think we're very aware of that, and we're always willing to make some exceptions to clinical exposure because of the pandemic. So I think as long as that's stated somewhere, and usually it is, then that really gives us an idea for why you're submitting a letter that may be a bit unconventional. But certainly if you worked with somebody and they can speak to your character, that's what we really care about.
And again, just in a personal opinion, but I'd like to hear others too, but I wouldn't feel obligated to send neurology letters of recommendation if you feel like somebody else would have spoken about your clinical acumen or personal character or anything better. So if you're using that telemedicine one because it was your only neurology rotation, but you were just kind of sitting there quietly with the camera off, then don't do that just because it's neurology. I don't know if that was part of the background of that question, but
Yeah, I
don't do that.
agree. And there's a lot of thumbs up going around. I think the strongest letters are going to be from people who know you well and can speak to, to your motivations and your character and your abilities. And so I think it's less about who's writing the letter and more about the authenticity and detail that they can provide in that letter.
Thank you for your responses. I'm going to have Maya ask the next question.
Thank you. The next question actually touched on what both of you just answered. It was asking what constitutes a strong letter of recommendation, if you have preferences on physician specialty, or if it could be a research mentor. So if anyone else had anything to add, this would be perfect time for that. If not, we can move on to the next one.
I think the only thing that I would add is that if you have significant research experience, and that's something you're highlighting in your application, you certainly should have a letter from your research mentor, even if they, might not be in neurology, for example. So I would just say that if you are someone with a significant research background, having a letter from your PI, if they're, a PhD in bioengineering or something, that I think that still is really valuable, especially if that's a large part of your application.
I can just add that we can recognize a good letter writer from a poor letter writer. And so sometimes you don't know, is the person that you think knows you really well going to translate that into a letter? And there's a lot of anxiety around, should I use this person's or this person's? And you may not know. So I would say that you always try to do the best you can to really give someone a shot that knows you well. But if they write just an absolutely terrible letter on your behalf, because it's just poorly written or they didn't put the time into it, we can usually pick up on that. And I don't know about the other PDs, but if I see that somebody clearly just didn't put much time into it or just rushed through this, I don't put a lot of weight into that. So just for what it's worth.
Yeah, I'll just add that when asking for letters, I think it's always helpful to discuss your request with the person directly if you can, and in person in a conversation. Provide them with your personal statement, your CV. You can even remind them of maybe a meaningful patient encounter that you shared on service with them for, to give them some fuel, some context, but try to give them as much information as possible, and you'll really get a sense. I think they'll be honest with you if they don't feel like they can write you a strong letter. But give them sort of all the fuel to make that letter as strong as possible.
Yeah, I know we're limiting, but I'm going to jump in because I think these are all really good points. The thing I'd add is, so suppose you have someone who knows you really well, but you don't know whether or not they're a good letter writer. And then you have someone else in the department who you didn't work with enough. You don't want their letter, but they're a division head, or they're a chair, or they're a program director. Ask them whether or not the other person is a good letter writer, because they may very well know, because there are certain people within our division or our department who are better or worse letter writers. And so you might be able to get a window into that.
Wonderful. Thank you all so much. I'm going to pass it on to Haley for the next question.
Okay, our next question is from the chat. I think we touched on it a little bit about personal statements, but I'm going to go ahead and read it. Everyone is saying something different about personal statements. Some say to focus on their current journey to medicine. Others have said to make sure to discuss where they see their career in neurology going. Is it a red flag or concern to not mention in the personal statement what they are looking for in a program or what they see their career becoming?
You all submit such great questions. No, I don't think it's a red flag. I think it's nice if you have an idea of what you're hoping from a program, because then that program gets an idea of, are we a program that might fit what you all are wanting to get out of the program? I think that if you're saying that you want to go to a good residency and be happy, I think we all want that for each other. So if it's something specific that you're really looking to get out of a program and something that you think that's really important to your career development, then certainly mention it. If not, if I don't see that, it's not a big red flag at all.
I will add another thing to personal statement. Someone asked me the other day, can we get help from ChatGPT to write personal statement? And we actually had this in our division meeting, and then we decided this year that the final selectee, like the people we'll actually have for interview, will run the personal statements through the software. So I think if we are doing it, I think other people will do that as well. So just be sure, whatever you're doing, it's you. You may not need help from AI at this point. So just so you know.
And it probably won't do a good job. I'm yet to be very impressed with most of ChatGPT's work. I think you'd be doing yourself a disservice.
All right, thank you all. Our next question is for Andrea.
Great, thank you. So the next question is about the step 2 scores being available right on time for the deadline. Someone is asking if we have to redo step 2 and our scores are going to be available in the beginning of November. Should we wait to submit our application until it is complete, or should we submit early?
Can we just raise it? Submit early.
Submit early for sure. I think if you wait too long, you take the risk that your application isn't reviewed until later in the season, and by that time, interview slots may already be filling up. So earlier the better, I say.
Yeah. So I'll just add to that. We did like a small survey among our regional programs in the state of Kentucky and surrounding states. So 72 hours was the top time when all the interview slots were just 3 days. So because I think it took people 1 to 2 days to go through the applications, and then applicants took another 6 hours to hit the accept thing. So I think that talks a lot about early applying.
This may be slightly off topic for the question, but be mindful too that we're all asking for early applications, but doing holistic reviews of all the applications takes us time. So just because we have your applications early, it's a little different than it was in the years past, where we could just kind of churn through some filters and spit out some yes or no's. It takes programs sometimes several weeks to go through. So just be patient with us. It doesn't mean that we don't like you. It doesn't mean we don't like your application or we're trying to string everybody along. It's that we are truly trying to take our time to holistically review your application.
Thank you all so much. I think this is the first question when we had all generally agreeing with your faces right away. That's awesome. I guess our next question is Gabrielle.
Yep, so we were just talking about letters of rec. So just a couple more questions about that is, how many letters of rec should we submit if the program's website does not provide a specific number? And then again, we've talked about it a little bit, but just to be clear, should we include a letter of rec from another specialty outside of neurology, or should we go 100% neurology?
I think I agree with the number 3 that was up there. I would say if there's no specification, I would say, 3 letters of rec would be the number I would aim for. And I think echoing comments we said earlier, whether they're all neurology or include other specialties, I think depends on your specific experiences and who can write you a strong letter of recommendation. I certainly don't think they have to all be neurology.
A strong internal medicine sub-I letter or pediatric sub-I letter where they say something to the effect that you functioned at the level of a resident, or you were carrying your own patients, or doing those sorts of things, will carry more weight than any of the third best neurology letters you'll get, barring you being such a rock star that you don't need any advice.
And that verbiage is a very nice verbiage to see in a letter of recommendation. I think we always highlight when.
Thank you. We'll move on to Lauren.
So the next question is regarding graduation cutoff. We have a question from the chat asking, will my application be considered if I apply more than 5 years after graduation, taking in consideration that I was doing postdoctoral research fellowships during this period?
I think Dr. Qaiser kind of already alluded to this, and I'll just concur that beyond 5 years, have a good story, and then that's a good story if you're working towards doing clinical neurology anyway, and this is your goal, and you also want to be a clinical researcher, and that's your story. That's totally fine. Just have a story. You can use that in your personal state.
Thank you. I'm going to have Nancy ask the next question.
Our next question is from the chat regarding IMGs and their U.S. clinical experience. They ask, how should we approach putting electives or away rotations in ERAS? Do you prefer if they put it in the education section or an individual elective as a separate experience?
I don't think I have, at least me personally, I don't have a preference. If it's there, then we'll see it. So I don't think it matters, at least from my standpoint.
Yeah, the advantage of a holistic review is honestly, like, if you're trying to figure out which thing you're going to slot it into, if it's in there and the verbiage is in there, it's going to get seen.
Yeah, I would just remember that you have 10 experiences to highlight. So prioritizing what those 10 are that you want to provide more explanation and context for might determine if you want to put this clinical experience there or elsewhere. So I think it depends on how you're using those 10 experiences.
And I will add another line to that as well. Especially for IMGs, if you have US clinical experience, then probably a recommendation letter from that experience would help more than anything. So then people actually know and comment on that. So if I'm doing a holistic approach of the application, probably the more time I'm going to spend in that letter of recommendation and how personal and meaningful that is, rather than aligning your experience. Thank you.
Thank you for that. I will go ahead and pass it on to Maya for the next question.
Thank you. So this was already answered in the chat by Dr. Keener, but in case anyone else had something to add, from the chat, they were asked, how would you suggest to get to know the program and people that we're interviewing with, and what are key things to keep in mind about the fit for the program?
Agree with Dr. Keener.
Yeah, I think this is a great question, and it's basically the whole point of this process is for us and for you to find a good match. And I just want to remind all of the applicants out there that you are highly coveted. We are trying as much to impress you and show off our program as you are trying to impress us. So it really is a two-way street, and it's about finding that good fit. And I think using social media, the website, and even reaching out to, current residents in the program, to ask questions throughout the interview season is a great way to get some insights. Many programs are putting on virtual open houses that NMatch has been wonderful about advertising and keeping track of. So I think there's so many opportunities to get to know programs, but just want to remind everyone that it really is a two-way street, and so take advantage of that. Ask your questions of us, and take the time to get to know our programs.
Yeah, I think that's really good advice. For also recent graduates, like again, in some programs graduate tons of people a year and others don't, and we don't, so this is not a self-serving recommendation. Talk to people who graduated if they're at the institution, or if they've gone somewhere else. If they're only a few years out, ask them, particularly if they're not beholden to toe the party line anymore, and see what their experience was like and what are the things that they know from having been there.
Thank you so much. I saw head nods as well from everyone else. So I'm going to move on to the next question, which Haley will ask.
Okay, this next question I think was touched on in the chat a little bit, but I'll kind of open it up to all of you. The question is, does it make sense to signal a program that we did an audition away rotation at?
This is tricky, and I think someone else had it in the chat too. So what I can say is ask the program. I think that if you have the chance to meet with people in the program, or while you're there doing your AI, try to meet with the PD or an APD and just say, what's your preference? I've loved my time here. Or you can say, I hated my time here, I'm not going to signal you. If you liked your time and it's a program that you have interest in and you express some of that interest, some programs might say, that's great, we loved having you too, don't waste a signal on us. We understand, we have a mutual understanding of our interests together. And some programs might say, yes, we do prefer that. A lot of other people in our committee review these and they may not know, blah, 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 blah. So I would just ask the programs. It's every home program, every away program tells you something differently. So for instance, we tell our AIs and we tell our home students not to signal us, that we feel like we should have some understanding together of whether or not that's needed. But every program may be a little different. So just have that conversation with them is my best advice.
Okay, I saw a lot of head nods, so I think you guys are all in agreement on that one. Yes, and a thumbs up. Okay. Our next question, Andrea will be asking.
Our next question is about couples match. Someone asked in the chat, how amenable are your programs to emails or letters of interest this year?
So I will just say I couples matched myself, and so I commiserate with all of you going through it. It's an extra layer, I think, of stress in the process, but I think many of us understand that you're all adults and have lives outside of residency, and that having that personal support network is really important and valuable. And so I think we all get emails and I think letters of interest throughout the year, and even more so around this time of year. I will say, I do sort of make note of those. And I think for applicants who we choose to interview, who are couples matching, we do, try to be mindful and, reach out to the partners program to just say, we're interviewing this person. They're couples matching with someone in your, in your specialty, so that sort of it's on the radar. But I think, I think there's sometimes perhaps a different strategy for those of you who are couples matching and trying to find programs where there are multiple programs maybe in the same city to come up with different combinations for you two. Is a strategy to consider, but yeah, best of luck.
Yeah, I think it's appropriate to do and to reach out and to give them that information. I would keep it short. I would not send a giant lengthy email, both because you won't be doing yourself a good service and it increases the chance that they scan it and miss that or do that. I would send a very brief thing where you just explain like that, if we're couples matching in this area for this other person with this residency, and short, but I think it will be well received. I don't think you do any harm to yourself.
Thank you so much. Our next question is asked by Nancy.
Our next question is from the chat, asking what your thoughts are on a combined letter of recommendation that is co-signed by 2 PI mentors.
Why not? No, I think the content of the letter is more important than the than the 2 signatures at the end, but I think it's fine.
I see a couple thumbs up and nods, so we can go ahead and proceed to the next question, handing it back over to Andrea.
Someone is asking in the chat about the length of personal statements. We already touched a little bit on this, but I guess the doubt is that on Word documents, personal statements look like 1 page, but then you put them on ERAs and they look a lot longer. So the person is asking, how long should these personal statements be?
I would say from that too, and I think I answered part of this in the chat, but not all programs use ARIS for reviewing applications. Some download, some we use a program called Cortex, which is associated with Thalamus. So I never even see what it looks like in ARIS, to be quite honest with you. So I think if you're doing it based off of what looks appropriate to you, and again, like I said in the chat, you have to say what you want to say about you. And if that takes a page, then great, on a Word document. If it takes a little bit more than that, then great too. If you're just rambling to fill space, then it doesn't matter, at that point. So I would say what you really want to say and let us get to know you, and however long that is, then that's meaningful and important to you. But I never even see what it looks like in ARIS.
Just don't dilute your own application. Don't dilute your own strengths. This is my thing about CVs. This is my thing about personal statements. So don't dilute it down by making it longer because you're trying to throw in everything, because that will take away from the strongest points you're trying to make. So for our own trainees, I try and have them do about a page, though yes, a page might be a different thing more or less depending on formatting.
Thank you so much. Laura, you're next.
Yeah, so another question from the chat. We touched on it a little bit, but I just want to sort of make sure this question gets answered. If you have a variety of leadership and research experiences, but they are not necessarily neurology related, would you question the applicant's interest in the field of neurology?
No.
No, I think this comes down to the narrative of the entire application together. And I think somebody else asked in the chat, they just decided to change specialty to neurology relatively recently. I think as long as you sort of explain your rationale behind that change, and certainly the accomplishments you have in other fields are very valuable and demonstrate your work ethic, your passion, your commitment, your ability to lead. All of those qualities are valuable, whether or not they were in neurology specifically.
Thank you for those responses. I'll have Neha take the next question.
Thank you, Laura. So the next question is, what 2 or 3 characteristics of the type of incoming resident is your program looking for?
This is so variable. I think probably 2 things that stand out. Someone who's hardworking. Residency is tough. It's tough from a professional standpoint. It's tough from a personal standpoint. So being hardworking and coming in with the mindset that they're going to put their head down and go through this with a lot of colleagues. And then collegiality. it's really important that you support each other, that we all support each other. Neurology is a small community. So someone who comes in willing to work hard and be collegial, it's good for us.
Just use other random adjectives. I think resilience is a nice one, and then interpersonal communication skills as a general principle.
Yeah, I'll add another adjective. I'll say passion and authenticity. I think somebody who really demonstrates a true love for what they do and what they care about, whether that's in the research or clinical care or advocacy, whatever that area might be. Somebody, I think, who brings that true love of what they do is something else that we look for.
Thank you all for
Did we just create the ultimate candidate, I think?
I agree. I think that would be the ultimate candidate. Our last question for the night, since we're coming up on the hour shortly, will be said by Haley.
Okay, our last question is, can we list clinical experiences that were prior to medical school if they were meaningful?
And this can be actually very important for specialties like child neurology, where we understand that you may not actually have opportunity to have clerkships in different programs. So why you really want to become a child neurologist? Well, I was in undergrad program and I ran a 2K for autism or for epilepsy month. I wore purple or something along these lines. So it has nothing to do with you're doing in medical school, but really that defined your purpose in life. So yes, please, we actually would like to know more about that part than the things which are already in your CV and other things. So thank you.
Yeah, and to that point, one of the questions a while ago in the chat had something to the effect of, what were some things that made international medicine graduates that came to your program stand out? So one was an emergency medical technician. They're basically an EMT paramedic and did that for a number of years before they ever went to medical school. And that was very meaningful and demonstrated a lot of skills that served them very well as a resident.
Okay, great. Seems everyone is in agreement on that one as well. I'm going to go ahead and hand it off to Maya for closing remarks.
Thank you, Haley. Thank you to everyone that attended our session tonight. I wanted to open it up the last 5 minutes, wrap up to respect everyone's time, but to open it up to the program directors, any closing remarks or comments that you have that weren't said yet tonight.
The thing I tell, so I advise, different people in different situations, medical students, both in our institution and elsewhere and other stuff like that. And so the big thing I always sort of tell people when I close out is, this is my opinion. I'm one person. I alone do not unilaterally decide the residents that our own program takes, let alone the others. So your best bet is to poll a number of different very qualified people that you respect, and you will get different answers, and then you have to use a little bit of your sort of critical crowd think and decide which things you want to take and which things you want to do based on your own experience. So get as much quality advice as you can.
I just want to say that I think recruitment season is one of my favorite times of year. We really enjoy meeting all of you. I find it to be invigorating and inspiring to see the next generation of our field and get to chat with them. And I want to encourage all of you to take advantage of the networking opportunities that come along the way during this season, meeting even other applicants who might be your future co-residents and who you certainly will run into at the AAN, for years to come. You're really starting to build your neurology community through this process. And I think that's sort of one of the, side benefits of the whole interview season, is just getting to know people who are passionate about neurology like you are. And so enjoy making those connections. That's my advice.
These are great. I agree with everything that's been said wholeheartedly. If I could give you another piece of advice, slightly different, keep doing the things that you love to do outside of medicine that make you who you are. This can be a busy time of year, even though it's supposed to be fun. Have fun with it. Make sure that you're doing the things that you'd like to do outside of medicine, and build those into your schedule now. As you transition into residency, if you already have your life that's a hectic life and a busy life with things that you love to do that are already built in, it's going to be a lot easier for you to transition and carry those into a busy residency life too. It's a lot harder to keep yourself grounded when 6 months into your residency, I'm asking our residents, when's the last time you read? When's the last time you rode a bike? When's the last time you went for a hike? So build them in now. You're going to be busy no matter what. You might as well be busy doing some of the things that you love to do built in. That would be my recommendation, is have fun. This is a fun year, and do the things that you love to do.
Thank you. And thank you so much to each and every one of you for being here tonight. We appreciate your time. We know it's valuable and all the answers that you gave us. I want to remind everyone that logged on today, we did record this session, so we'll be sending it out. If your question wasn't answered, we have another session on the 19th. So join us for that, and keep up with our social media and NMatch 2024 on Twitter and on Instagram. Thank you to my fellow NMatch team. They've been invaluable this whole season and will continue to be so. And thank you for all of you that joined, for respecting our rules at the beginning of the meeting and for being so engaged. We hope that this inspired you and made you feel a little bit better going into ERAS season. And thank you again for joining. Have a good night, everyone.